It's an amazing achievement, isn't it? And if you think about the rate at which this vaccine was developed and rolled out, it's unprecedented in the history of vaccine development and a major success story. But we've still got a bit of a way to go with this vaccine.
Yes, and the research found that, you know, quite a lot of the lives that were saved were in wealthier countries, less so in sort of developing countries. Do you think that's where more progress needs to be made, getting the vaccine out to countries that haven't had so much of it yet?
Absolutely, because, you know, the pandemic hasn't gone away. Sadly, the virus is still around, and we are dealing with variants all the time. We know that around 66% of the world's population have received at least one dose of the COVID vaccine, but only 18% of people in low-income countries have received at least one dose. So there's still a big challenge in getting vaccination out to those countries.
And where do you think we need to go from here then? Does that need to be the focus in getting the vaccine out to other countries rather than having booster jabs for people who've already been vaccinated?
Yeah, this is a big sort of ethical dilemma, isn't it, really? Because we do need to carry on with booster jabs, and we will need those in the UK and in other countries, particularly as we enter the autumn and we're faced with new variants. But we've also got to keep an eye on what's going on in other countries, not only to protect the people in those countries from getting very sick and dying, but also to protect ourselves, because if we protect other countries, we'll stop these variants from popping up. So we've got a bit of a dilemma here, and it's as much in our interest to support the rollout of vaccines in other countries as it is to continue vaccine rollout and booster jabs in our own country. I don't think this needs to be an either or. It's all about resources. It's all about the ability to manufacture these different vaccines and to make sure that we're supporting the health infrastructure in countries that need more vaccination.
Okay, and just looking at COVID a bit more as a whole, then I suppose, you know, it's been top of our minds for the last couple of years, but it seems as if, you know, it's slowly coming down the agenda, if you like. Where do you see things going over the next year or two?
Yeah, I think this is a bit of a worry because we're not out of the woods yet, and this still is a very dangerous virus. It still can make people very, very sick, and we have all the uncertainties associated with the long-term effects of infection, so-called long COVID. So I think we still need to continue to be vigilant. I think the winter is going to be challenging in the UK because we'll have new variants that might be more infectious than us able to be protected against by current vaccines, alongside other respiratory infections. So I think we still need to remain cautious. We need to keep our surveillance systems going. We need to, I think, look for what the next developments are in vaccination. Yesterday, Moderna, one of the mRNA vaccine companies, presented new data on their new vaccine, which is a vaccine that combines the old original virus with the Omicron variant, and it showed very, very good immune responses that can protect against BA4 and BA5, and those are the current variants that we're worried about. So I think we need to keep an eye on vaccine development and what's needed both here and in other countries, and certainly keep surveillance going, because we need to keep monitoring what variants are popping up and be careful to ensure that we know who's infected, where they are, and that we can manage and control infection. And as I said earlier, I think once we come out of the summer, we're gonna have some issues. We're already seeing very high levels of infection again in the UK. We've seen an uptick also in hospitalizations, and that again demonstrates how important it is that people who are able to get booster jabs, who qualify for the 4th jab, should go and get their booster jabs as well. But also that we will need a lot more people getting 4th booster jabs as we enter the autumn.